Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We are your hosts, Dr. Jamie Erwin, board-certified OBGYN,
and Dr. Kathryn Nader, licensed professional counselor with a PhD in counselor education and supervision. Jamie and I have been friends for over 30 years.
Each week, we explore the intersection of body, mind, and soul, bringing you evidence-based medicine, meaningful conversations about mental health, and stories that remind us we're not alone on the journey.
So take a deep breath, settle in, and let's begin the journey.
Okay, welcome back. Another Wednesday in Pink. Today, we're talking about something that touches nearly every person listening, whether we realize it or not, and that is trauma.
Trauma is a word we hear often, but many women still wonder, what actually counts as trauma? Why do some experiences stay in our bodies for years? Why do certain smells, sounds, conversations, or relationships trigger reactions we can't fully explain?
So today we're unpacking the different types of trauma, from acute trauma and chronic stress to childhood trauma, relational trauma, medical trauma, grief, betrayal, generational patterns. We're going to talk about what trauma does to the brain and nervous system, how it can affect us physically, how it can affect our sleep, our hormones, anxiety, relationships, even the way we see ourselves and the world.
And most importantly, we're going to talk about hope. Healing is possible. We'll discuss evidence-based treatments, practical tools, therapy approaches, nervous system regulation, and how women can begin to move from surviving to truly healing. This is a powerful conversation. We're so glad you're here with us. And let's get started. Dr. Nader, trauma, lead the way.
Trauma. Okay, so trauma it's such a big topic right now. And the definition of trauma can vary kind of by what approach and what perspective that you are looking at. But really, trauma is a time, I like to think of it as trauma as just being a time where you feel overwhelmed or helpless in a situation. So it could be a physical trauma, it could be an emotional trauma, it could be mental, it could be sexual, it could be witnessing a traumatic event, but a time that you feel helpless, you feel maybe fear or overwhelmed. And really what I see with my patients is that it changes the way you see yourself and it changes the way you see the world. So maybe the thought of like, I'm not safe, or the world isn't a safe place, or I'm a failure. People don't like me in general. Just kind of this change of perspective.
Of course, I'm immediately tapping in and thinking about my patients.
Sure.
As an OBGYN, my patients come to me perhaps, having already experienced trauma, or especially in the obstetric population, birth, labor, and delivery. I mean, that's immediately what I go to. So whether it's an emergency, I could see how they feel like my body failed me, or I didn't do it right. I, had to have a C-section, or I'm broken in some way, or even, with patients who experience early pregnancy loss.
I'm responsible.
It's my fault. So it changes how they see themselves.
Yes.
Wow. Okay.
Yeah. So, so trauma can have major effects on us, physically, mentally, emotionally, in our relationships. It can play out. We just had the organizers on in the last two episodes, and they talked a little bit about how trauma can affect even the stuff that we choose to keep around us, how messy our house is or well kept. It can have so many different effects on us.
What do you think is the most profound way that trauma affects us?
I think in the view of ourselves, because the way we view ourselves or the world can play out in every realm of our life. How we treat our body, how we interact with people, how we do our job, how we parent, how we live our lives, because now we have taken this. I think of it as on the movie Inside Out, where she has that experience, that memory, and then she creates this belief about herself from that experience. And that's what happens with trauma. We have this event, and then from that event, we create this belief about who we are.
Wow.
And that can then translate to so many other places in our lives.
That's powerful. I do love those movies.
They're so good.
They're so good. They're so clever, so poignant, just really some hard truths that get portrayed. So if you haven't seen Inside Out 1 or 2,
both of them, they're great.
Oh gosh, they're so good. Yeah. Okay. So what else do you have for us? Different types of trauma,
Yeah, there's
right?
different kinds of trauma. So the first would be an acute trauma. So something that happens, it's a single incident, it's a one-time thing. This could be like a car wreck.
Okay.
Just a traumatic event happens one time. Another kind would be chronic. So this could be repeated and prolonged. So it could be an abuse that happens throughout childhood. It could be bullying at school. It could be anything that just happens repeatedly over a period of time. And then there's secondary or vicarious trauma. So that's witnessing. So even in the childbirth, maybe for the mom, it's an acute, moment of this traumatic thing. Then maybe for the partner who's there with her, it's vicarious trauma. That's traumatic to watch this happen to the person that you love.
So true.
And even for the medical professionals in the room, it's traumatic.
Yeah.
Or it can be. And then there's also PTSD or complex PTSD. So that's from repeated trauma. It could be from multiple different kinds of trauma. And that typically results in some shame and some really strong beliefs about who you are, as being maybe I don't matter, I'm not worthy, or I don't have value, that kind of a thing.
And that's post-traumatic stress disorder.
And then complex post-traumatic stress disorder would be that, but just something that's happened in multiple ways for a long time.
Okay.
Yeah. So let me give an example of how trauma can affect us, is just thinking from my own experience with just the acute trauma. So I was in a car wreck. I don't think I've shared this story on the podcast, but was driving home from on the freeway in the left-hand lane. It comes to a complete stop. So I'm literally parked behind a car on the freeway, nobody behind me, and I see this white truck flying up over the hill, doesn't see that we're stopped. I have nowhere to go. I'm literally parked, so I just brace myself for impact, and sure enough, this car runs into the back of me, smushes my car between these two trucks. Thankfully, obviously, I'm okay. I was okay. But it was very scary and traumatic, and a moment of complete helplessness, because I literally thought, there is nothing I can do. I see it coming in my rearview mirror, and I literally just tense every muscle and just braced. So after that, I would be driving, and suddenly I would find myself holding my breath and just really tense. And I literally would say, what am I doing? What is wrong with me? I'm just driving down Main Street or whatever. What is going on? And I would look in the rearview mirror, and there would be a white truck.
Oh my gosh.
So my eyes had seen that white truck, send it straight back to that trauma part of my brain that we talked about with Kate Jennings a few episodes ago, that,
primitive part of your brain.
Yes. And had immediately sent it to my nervous system and said, brace for impact.
Stop
This
it.
white truck is about to hit you. So I would literally have to make myself take deep breaths, remind myself in the cognitive part, millions of white trucks have driven behind you probably in your lifetime, and only one of them has hit you.
Yeah.
Like, take some breaths. But that is what trauma does to us. It sees something, because remember, our brain's job is to keep us safe, get us back into bed at night. And so it's always looking for danger. So when we've had a traumatic experience, our brain registers that thing as danger, and it wants to protect us. So when we're dealing with trauma, a lot of time that can lead to anxiety, maybe anxiety about driving, about being in another wreck, anxiety about leaving your house. I mean, it can just continue to grow. And so we have to recognize that cognitively, yes, we can work through it, but we also need to work through processing in the back part of our brain what's going on, what our brain is telling ourselves that's giving us that response. And I think often we get frustrated with ourselves when we recognize those things, or even in the people we love, when it can be such a quick response that we really aren't cognitively thinking through. It's literally can be a knee-jerk reaction that our body is having to this trauma that we've experienced before.
Yeah, in order to keep us safe.
In order to keep us safe. That's our brain's job.
Yeah. That's incredible. So even before you had figured out that it was a white truck, your brain had sensed it.
I would literally recognize I'm holding my breath and I'm like super tense, and I literally would say, what am I doing? What is wrong with me? I'd be driving along, listening to music, whatever. And then all of a sudden I'm tense and holding my breath.
And then you registered and processed that, oh, there's the white truck.
There's a white truck behind me.
Fascinating.
Multiple times.
Oh my goodness.
Mm-hmm. Yeah, and it would happen that if I was riding in the front seat, this was fun, in the passenger seat, and we got too close to the car in front of us, I'd, oh my gosh, which is so annoying for everyone that you're with. My husband Joseph loved it.
So my son does this.
Yes.
Okay, so my son is now 11, but when he was about 5, he was in a car wreck, 5 or 6, with the nanny.
Yeah.
And the airbag deployed.
Yes.
And
Scary.
he is still, he has that same reaction. So if I have to brake a little more suddenly because a car, is turning into a parking lot or what have you, he's still, years later.
Yes. Oh, yes, it can last.
So what do we do?
So there's different treatments for trauma. So let's talk about those. There are multiple different kinds. The first one is trauma-focused CBT. And that CBT is cognitive behavioral therapy. A lot of people have heard of cognitive behavioral therapy. It's really addressing the negative thoughts that we have.
Is that therapy?
It is therapy. It's talk therapy.
Okay.
Yeah. So trauma-focused is looking at the specific effects of that trauma and trying to address the negative thoughts that we have. This can be a helpful form of it. It can be difficult just because of what we just talked about. I can reason up here, but not always is that the part that's being affected by the trauma. But people can have good results from that. Another one is somatic therapy, and that's really focusing on your body and releasing that trauma that we're holding in our body, because we know our body holds on to trauma. The book The Body Keeps the Score is an old classic, but really great, talking about how we hold on to trauma in our bodies.
Say more about that. Let's dig in a little to that, because somebody could hear that and be like, what does that mean?
Where do I hold that?
What are you even talking about?
So from my own personal experience as a therapist, I use, and it goes along with this one, EMDR. And EMDR is eye movement desensitization and reprocessing, but it's basically using bilateral stimulation, so both sides of your brain. So tapping, I like to use tapping either on knees or on shoulders because I treat women and that gives them full control. But people can use lights or their fingers for the client to move their eyes back and forth. For kids, it can be jumping back and forth. It can be anything that's one side to the other. We do this naturally when we're holding a baby. We rock. It's a natural way that we kind of self-soothe.
Side to side.
Yeah.
Okay.
So that's what it does, and it allows us to reprocess. And so what I say this about the body is that, to me, the goal of trauma therapy is really to feel safe again in our body, and to feel safe again in ourselves and in the world around us. So when we're processing with EMDR or these other therapies, what we're trying to do is recognize where we feel it in our body. A lot of times when people are describing for me what's happened, I will say, where do you feel that? Tell me where you feel that. And pretty much every time they can tell me, I feel it right here in my shoulders, really tense, like I did. Or I can feel it in my chest. It feels really heavy. Or I feel it in my stomach, or my hands feel tingly. I mean, it can be all over the body.
Okay.
And just going with that. Okay, so that's where your body is feeling that or holding that. That's where that memory can be. And then we process through that with the bilateral stimulation and noticing how they feel and the differences that they experience as we go through. So it's fascinating because you really can see how they relax as they're going through the processing, how they start to feel that reduce. We do a SUDS scale of how strongly does that you feel it on a scale of 0 to 10. So we start with whatever number they're feeling it at, and hopefully work our way down, which is really fascinating because your body really can hold on to it.
Wow, that's awesome. And you've had great success with clients.
Yes, I can't ever guarantee anything, but there's not been many people that haven't said it was helpful for them.
Great.
Yeah.
That's fascinating.
It's really, really neat to see. And when I first became a therapist, I did not think I wanted to do trauma therapy, but it's actually one of my favorite things because you're able really to see how it can help set people free. The change in that they physically feel, and how it affects their lives. It's pretty amazing.
That's powerful.
Yeah, it is. So those are just some of the types of, and there's prolonged exposure, prolonged exposure therapy. So there's all different kinds. I personally use EMDR, and that's typically what people use for PTSD. That's usually a lot of what the VA uses for vets, and it can be a helpful therapy for people. And for me, that's what I actually did too for my car wreck. So going to EMDR therapy was amazing. Like I felt a difference driving home after my first session. It was incredible. And it literally was like, I think of it as trauma. It's like we create, like we talked about with Inside Out, this belief about ourselves, or it's like, I think of it as a file. We create this file now. I am a failure, or I am unsafe, or I don't matter. And now suddenly anything that might slightly relate to that goes into that file. So the file continues to get bigger and bigger and bigger because we've created this file in our brain. So when we're processing, what we're doing is we're opening that up almost like a junk drawer, shaking this stuff out and saying, hey, here's this memory. How I interpreted it was I'm unsafe, or I'm not a good person, or it's my fault. Is that really true? And we're kind of almost like the reorganizing episode, saying, okay, actually that goes in this file over here. I did the best I can.
Yeah.
I'm human. I make mistakes. I am safe. Now that's over. Because a lot of times when we think about trauma, we feel like we're still there. Yeah. Like me, my brain was thinking, I'm still here. I'm going to get hit by this white truck when I'm not there anymore. I'm in a totally different situation. So refiling it of, that's not happening anymore. I'm okay now. I am safe. So when we're doing that reprocessing, that's how I think of it. Like we're refiling and making more sense of it. Because if it's untreated, trauma can lead to addictions, for sure. We see that a lot with PTSD. It can lead, of course, to anxiety because we're anxious. I mean, for example, maybe you have a panic attack because I think, oh no, that white car's going to hit me. So then I feel anxious about having a panic attack because I don't want to have that. So it just kind of spirals, like we've talked about with anxiety, how it just continues to grow. And this trauma can be the thing that kind of sets that off. Okay, now I don't want to drive anymore.
Right.
Okay, now I'm not going to get in the car with anyone. Okay, now I'm not going to leave my house. I mean, I've seen clients like this.
It can just escalate.
It just continues to grow because we just hold on to it and aren't able to process it. Then it can lead to relationship issues. I loved the example the organizers gave us of the driving in the car but not being able to see out on the road trip. I mean, that's kind of can be what trauma feels like too. It clouds our vision. We're not able to see things clearly or the people around us. And then it affects the people that are around us because we're responding in these knee-jerk ways that maybe aren't even about them. It's about our own stuff, but they don't understand that. Our kids don't know that. We're just responding so quickly, and so that can affect them as well.
Wow. I'd love to talk through maybe, make it make it closer to home in my field of OBGYN. And maybe talk through a scenario where a patient has a traumatic birth, per se, hypothetically, of course. So, one potential complication of childbirth is postpartum hemorrhage.
Yes.
So when that happens, a lot of times there's no risk factors identified. It just happens for no particular reason. Let's talk through kind of how a patient, her loved one, me as the doctor, might be affected by that with that sort of traumatic incidents. What do you think? So
I think that's a great example. So it could be that thought of, for the patient, maybe I did something wrong, even though they didn't. We can still interpret it that way, like there's something wrong with my body, or I failed somehow. The belief can be I'm unsafe. I did everything right, it seemed like, for the birth, but I don't feel safe in my own body. It can even be the thought I'm going to die, which is scary. And for the person, the support person who's there with them, their partner, it can be the same thing, of thought of like they're going to die, or this is unsafe.
I can't help them. A helplessness feeling.
So what we would do in EMDR is we would say, okay, when you're talking about that, where do you feel that in your body? And they can typically locate it. What's the belief that you have about yourself when you think about that? We give it a scale on that 0 to 10 of how strongly they feel it. Sometimes even we think back, sometimes it feels so strongly because there's another instance of this that it's kind of connected to, kind of like that file. Maybe this isn't the first time this file has been created. Maybe there's been other kinds of medical trauma, or maybe this partner has is an EMT and has seen these things happen, and seen somebody die, or
maybe the patient had a hard time getting pregnant, or maybe she had multiple miscarriages, so she feels like her body failed her then, and then she finally did have the baby, but then she almost bled to death.
Yes. So that file, which could make it even stronger, because it's like, see, I told you, could be already there. I mean, this could be the first time, or it could be other times. So we kind of might explore that a little bit. And typically, if it's been a thought that has been there previously, we'll start back there, because it's almost like a domino effect of working our way.
And you got to start at the beginning
towards it, if we can. So and then we start processing through. And then we also try to replace it with a positive belief, like I said, that and now I'm okay, or I did the best I can. It's over. I survived. So recognizing the belief that we have about it's not necessarily, it's kind of like the anxiety, where it's not actually the trigger, but what we tell ourselves about the trigger. Similar thing here. I mean, it is the trauma, but it's now what we take that we believe about ourselves that we're really addressing because of that trauma.
Yeah.
We're not saying that was okay, I was fine. We're saying, no, that was scary. How do we want to think about it?
Not minimizing it, but reframing it. I think with birth trauma in particular, some women can approach pregnancy as, well, my body was made for this. This is a natural process.
Kind of like breastfeeding.
Yeah, exactly. Which turns
you
out...
you try to do it and you're like, what in the world?
Yeah,
it's
exactly.
So true.
You just think it just happens, right? But, it just doesn't hold up because, in fact, our bodies are falling apart all the time, right? We're aging. Things like cancer happen. Things break down. Heart attacks happen. Strokes happen. No, your body is actually trying to kill you, right? And thank goodness for medical science and modern medicine, and things like C-section and blood that we can transfuse and ICU settings and doctors and nurses and all the people who can step in to help. So, but I think that's part of the story that women can tell themselves. This was supposed to be a natural process. My body was made for this, but yet this trauma happened, whether it be I needed an emergency C-section, or I had a miscarriage, or I couldn't get pregnant, or I hemorrhaged, or I had a shoulder dysstocia. I mean, the list goes on and on. But the truth is, like, bad things happen.
Yeah.
We live in this fallen, broken world where unfortunately there are complications and hard things do happen. So I think that's an important takeaway.
Yeah, it's so true.
In my field and what I deal with every day. What would you say to the doctors and nurses and healthcare providers who, and the EMTs and the CRNAs and all of the people who are surrounded by, you know, trauma.
Yeah,
I mean,
it is.
And in a way, I'm a little hesitant because I'm like, well, do I call that trauma? Do I, you know, like I do feel like, are we overusing it?
Right.
Are we not?
Yeah.
Do I need to name it? Do I need to call it what it is? Right. But how do you approach those? Because we have a lot of listeners who are colleagues and doctors and caretakers in general. So
I think that when you notice yourself a physical response after an event, I think that's a good way. Any sort of flashbacks, any sort of difficulty sleeping or waking up, replaying it, that can be a sign that it was traumatic for you. And I do have medical professionals that I treat that, you know, they'll message me after they've had a particularly significant thing, and we can process through this, you know, so that it doesn't continue to affect them in the future. And so taking the time to be aware, be mindful of how something affects you physically, emotionally, can be really helpful, because it can, you know, having that experience and that, oh no, this is a similar situation, is not going to happen again. Kind of the white truck, like you feel yourself go into that response, and then are like, why am I acting this way? I've done this thousands of times. What is the difference here? Oh yeah, last time XYZ happened.
And for that hypothetical patient who then conceives again next pregnancy.
Exactly.
After she has this history of whatever it may be, postpartum hemorrhage, emergency C-section, miscarriage. You know, how does that look for her, and what do we do to help her?
So similar thing. When somebody has had something like that happen, we kind of talk through what was the timeline of traumatic things. You know, maybe it was they went to the restroom and noticed some blood, you know. So we might probably start there, noticing, or maybe before that, if, like you mentioned, there was difficulty with conceiving, or maybe there's been a previous miscarriage before that's connected to. So I really try to take a good history of where we are in this journey, what this file basically looks like. And then from there, we kind of start either at the beginning, or if there's something that's so recent and it's just like nightmares, can't sleep, then we might start with that. It just kind of depends on the situation. But it can be helpful. And then maybe they feel like they've processed everything, and then they get pregnant again, and then they're near that week that something has happened before, and it might bring up new things. You know, even if we've processed it, your body's like, hey, I remember this, and you know what happened last time. And so then we'll process that at that point. So I have a few patients that have had a miscarriage, then we've walked through a pregnancy together, then they've had a baby. So just kind of continuing to stay in contact and deal with them as they notice those things that, you know, it's okay. We can deal with it.
Taking inventory, being aware. Oh, of course I'm feeling, naming it. I think naming it and validating it, like, of course I'm feeling it. This is the week that I had the loss. So of course I'm going to be feeling these things. That. This white truck is here.
Yes. Well, and even just like the body, I mean, another thing I think of is remembering working through COVID. I was working at the hospital. I know you were too. It was scary. It was traumatic. And I hadn't used my backpack that I used during COVID. And I pulled it out for something, and I put it on, and I didn't think of it that way as it being that COVID backpack, but just the weight of it, just the feel of it as I was putting it on my back the first time, I immediately had this like physical response and memories. It's so fascinating how our body holds on to those things. So when we recognize those things, not to be, you know, freaked out by it, but to be aware of it and say, okay, this is something that I need to process. This is something I need to deal with.
And not ignore it.
And recognize, hey, our body is wanting to deal with it. It's wanting to process this trauma. That's why it's coming up for me.
That's amazing. What else do you want to say about trauma, Mary Kathryn?
I mean, this is, again, just like a very, very short tidbit. The trauma is a huge, huge topic, and there are other ways of processing it. Of course, I mentioned the EMDR just because that's the treatment that I use. I'm not a trainer in it, though, so I can't speak to all that piece of it. But talking to your provider, if you're noticing these symptoms, seeing what they recommend for you, and really just paying attention to your body and these responses that you're feeling, and knowing that there's hope. You don't have to feel this way forever. There is treatment available, and it really can help you feel so much better.
I'm so glad you shared all this. Healing is not weakness. Healing is brave, and healing often begins with understanding what happened to us. And approaching it with compassion, like you said, instead of shame and guilt. Whether your trauma was loud and obvious or quiet and invisible, your pain matters, and your body does remember what your mind may have tried to bury. That's so true. There's real science, there's real hope, which can lead to a real healing process. If today's episode resonated with you, we encourage you to reach out for support. Talk to a trusted friend, a counselor, a therapist, a physician, a pastor, or someone safe. You do not have to carry this alone. Thank you for joining us for another episode of A Journey to Whole Woman Health. If this conversation encouraged you, would you please share it with a friend, leave a review, and send it to someone who may need hope today. We'll see you back next time.
Thank you for joining us on A Journey to Whole Woman Health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter, your health matters, and wholeness is a journey. Until next time.
Now for the legal language. The information shared in this podcast is for educational purposes only and is not intended as medical or mental health advice. Listening to this podcast does not establish a doctor-patient or therapist-client relationship. Always consult your own qualified healthcare provider regarding any medical concerns.